Hello, everyone, and thanks, Dr. Wan, for a nice introduction. I'll just switching gears and moving from the research-based lectures. I'm talking a little bit more about the clinical stuff and mainly in the dental sleep medicine. I'll try to keep it very informal and just like we'll discuss some of the cases in there. All right, so before starting, I just want to say we're going to discuss four main topics. Like one is clinical screening and the case selection. Like with any treatment, the main thing is the selection of the patient, and that can set you up for a success or a failure. And then we'll briefly review the sleep study, mainly what things to look for beyond just the AHI. And then throughout this conference, we have heard again and again the importance of the multidisciplinary approach to the patient, because it's not like one man's game. It takes a team to get a patient to where we want them to be. And then briefly touch on the insurance hindrance, especially in the oral appliance therapy, like what are the criteria that you have to look for, what are the criteria you have to make. It shouldn't be most relevant thing, but again, the world we live in, that's one thing that we still have to look for. All right, so recent years, I shouldn't say recent, like within the last 10 years or so, why there is so much focus on the sleep disorders. I would just have this slide and the number speaks for itself. It's a major public health issue, and it's still very low, the recognition in the clinician and again in the dental world is very low. It is improving, but there's still a lot needs to be done for that. And OSA has a severe health consequences. It's not just a lifestyle disorder. We know that especially in cardiovascular issues, neurocognitive issues, there's a lot of overlapping of the patients with OSA. And it's a costly, if you look at the long-term healthcare cost, it's a costly disease to have.